Welcome back to Stop Falling, Start Living, and happy holidays. Diabetes can affect your balance and stability, increasing the risk of falls due to poor sensation in the feet.
Watch diabetes videos at clearlyhealth.com.
As a person with diabetes, it is important for you to care for your feet properly every day. If you have nerve damage, known as neuropathy, you may not feel pain if you injure your feet. Because of this, an infection can develop without warning. Decreased blood circulation slows healing. This can result in foot ulcers, which can eventually lead to amputation of the feet or legs. Prevent foot injuries by wearing shoes that fit well and have good support. Don't walk barefoot. Check your shoes before putting them on for small pebbles, worn areas, or rough spots. Avoid sandals, pointed toes, high heels, and plastic shoes. Always wear socks in your shoes. Socks are better if they do not have seams or mended areas. It is important to check your feet every evening for cuts, sores, red spots, swelling, or infected toenails. If you have any of these problems and they do not heal within 24 hours, it is important to contact your healthcare provider. If you have trouble seeing the bottom of your feet, try using a mirror. Before bathing or showering, test the water to make sure it is not too hot by using a thermometer or your elbow. If you use a thermometer, between 90 and 95 degrees Fahrenheit or between 32 and 35 degrees Celsius is safe. Water that is too hot can damage the skin. Do not soak your feet, as they can become dry and cracked, causing infection. Be sure to dry your feet well using a patting rather than a rubbing motion. Be careful to dry between your toes and use talcum powder or cornstarch to keep the skin between your toes dry. Apply lotion to the top and bottom of your feet to keep them soft. Do not apply lotion between the toes, as this can cause the area to become too moist. Thick or hardened skin on the toes and bottom of the feet, called corns or calluses, can appear from skin rubbing against bony areas of the foot. If you have corns or calluses, it is important to talk with your doctor about how to remove them. Do not use corn plasters, corn and callus removers, or blades, as these may lead to infections. Trim your toenails straight across once a week. Smooth sharp edges with an emery board or nail file. Contact your doctor if they become thick or yellowed, or begin to curve and grow into the skin. Avoid using heating pads, hot water bottles, or campfires to warm your feet, and carefully check your feet during cold temperatures for frostbite. Keeping your blood glucose levels in your target range through healthy eating and daily exercise can prevent or decrease nerve damage caused by diabetes. Daily foot care, comfortable shoes, and having your healthcare provider examine your feet at least once a year can help minimize serious long-term damage caused by diabetic neuropathy.
For our full library of healthcare videos, go to clearlyhealth.com.
Hi, my name is Shannon Richard, and I am from the Department of Occupational Therapy at LSU Health Science Center in New Orleans. In this video, I'm going to review how to best care for your feet. Making these simple changes to your foot care routine can help you to live free from preventable foot care complications. Wearing appropriate footwear is a key component of proper foot care. Whether in-home or outside, you should avoid walking barefoot, in socks only, or in thin-soled shoes. Do not walk barefoot on hot surfaces such as sand or cement. Do not swim barefoot, as the bottom of pools may be rough, causing scrapes or cuts. Pool shoes or sandals that do not go in between your toes are good options to wear when at the beach or the pool. Wear appropriately fitted shoes. Shoes should be comfortable at the time of purchase. Do not depend on them to stretch. It is best to purchase shoes in the afternoon when your feet tend to be the largest due to swelling. Do not wear shoes that are too tight, too loose, have rough edges, or uneven seams. You should not wear sandals that go in between your toes. No single type or style of shoe is right for everyone. When buying new shoes, first let your foot care specialist check the fit of your shoes before you wear them so that you can return them if they are not right for you. Here are some things to look for when buying shoes. It is safest to wear closed toe shoes because open toe shoes are less protective and can lead to foot injury. It is best to buy shoes with cushioned interiors so they absorb some of the shock when you walk. You should buy shoes that do not pinch your feet or your toes, but not so wide to where your feet are sliding from side to side. It is best to buy shoes that have laces or other closures that allow you to adjust the fit of your shoe. Shoes made of soft leather or other flexible material, which will have some give and stretch as you wear them, are best. The shape of your shoe should match the shape of your foot. There should be about a thumb's width between your longest toe and the end of your shoe, and you should be able to pinch some material at the sides of your shoes. You should always consult your doctor about the best footwear for your feet. Footwear should be wide enough for the foot without putting too much pressure on the skin. If you have had a previous foot ulcer, or if you have a foot deformity such as bunions or claw toes, ask your doctor about getting therapeutic shoes. Never force your feet into shoes that are not the right shape or size for you. It is very important that you never again wear the same shoe that has caused a foot ulcer. Look and feel on the inside of your shoes before you put them on. Check for foreign objects, rough areas, or torn linings. Wear socks and stockings without seams or with the seams inside out. Do not wear mended socks or stockings. Do not wear tight or knee-high socks, and compression stockings should only be worn if prescribed by your doctor. It is important that you change your socks daily because socks provide a protective barrier between your skin and your shoe and may prevent skin breakdown. Wearing white socks can help you spot red or yellow discolorations that may indicate a cut or an infection. Now we're going to review foot care guidelines. You should avoid extreme temperatures. Before bathing or showering, check the water temperature with your hand, elbow, or with a thermometer. Water that is too hot can damage your feet. And remember, if you have decreased sensation in your hands, do not rely on your hands to detect water temperature. It is very important that you wash your feet thoroughly every day. Dry your feet carefully, taking special care to dry in between all of your toes. If your feet are dry, you should moisturize the top and bottom of your feet with a thin coat of lubricating oil or cream. It is important that you do not moisturize in between your toes, as this can cause skin breakdown or fungus. You may want to consult your physician about the best type of lotion to use on your feet. Inspect your feet at least once every day. Good times to inspect your feet are before you put on your socks and shoes, after you take off your socks and shoes, and after you take a bath or a shower. You should thoroughly inspect the entire surface of both feet, including the areas between the toes. Check for blisters, cuts, scratches, reddened areas, swelling, sore spots, calluses, any color changes, dry skin, and infected toenails. The use of a mirror can help you to see the bottoms of your feet. If you have a visual deficit or if you cannot bend over to inspect your feet, have someone assist you in a daily foot inspection. Contact your doctor immediately if you notice an abnormality on your foot, such as a blister, sore, swelling, redness, or if you notice any pain in your feet. Have your feet regularly examined by your doctor. Be sure that your feet, including the areas in between your toes, are examined at each visit. Talk to your doctor about how often you should receive a professional foot examination. If you have thickened skin on your feet, such as calluses or corns, you should talk to your doctor about how to remove them. Do not do bathroom surgery yourself. It is very important that you do not use chemical agents, plasters, corn or callus removers, blades, or callus files to remove them, as this can cause a serious infection. You should check with your doctor first before cutting your toenails. Toenails should always be cut straight across, and it can be helpful to use a toenail filer often to reduce the frequency of needing to cut your toenails. Other do nots. Do not soak your feet unless specifically instructed to by your physician. Soaking your feet can cause dryness and infections. Do not use any kind of heater to warm your feet. Do not warm your feet using a hot water bottle, electric blanket, heating pad, or a campfire. If your feet feel cold, simply wear socks. You should take special precautions in cold temperatures. Wear wool socks and protective footgear, such as fleece-lined boots, and carefully check your feet for frostbite. These foot care guidelines can be a bit overwhelming, so let's review. These are things that you should be doing. You should wear appropriately fitted shoes, inspect your shoes before putting them on, wear socks and stockings without seams, avoid extreme temperatures, wash your feet thoroughly every day, dry your feet carefully, taking special care to dry in between all of your toes. It is very important that the area between your toes stays completely dry. You should moisturize the top and bottom of your feet, inspect your feet every day, contact your doctor immediately if you notice an abnormality on your foot, have your feet examined regularly by your doctor, and have your toenails cut straight across. These are things that you should not be doing. You should not walk or swim barefoot. You should not walk in socks only. You should not wear thin-soled shoes. You should not wear sandals that go in between your toes. Do not wear shoes that are too tight, too loose, have rough edges, or uneven seams. Do not wear the same shoe that has caused an ulcer. Do not wear knee-high socks or compression stockings. Do not moisturize in between your toes. Do not do bathroom surgery, such as using chemical agents, plasters, corn or callus removers, blades, or callus files. Do not soak your feet. And do not use any kind of heater to warm your feet. While these foot care guidelines can seem overwhelming, it is important that you take them seriously, because making these new habits can save you from having a serious foot complication, such as an amputation. Thank you for taking the time to watch this video. I hope it has given you a better understanding of how to best care for your feet.
When doing desensitization, if you are using ice, you should apply a little oil to the area to help prevent ice burns. Check your feet before and after any treatment, and if you are experiencing any problems, stop and consider medical advice.
This is our second video regarding foot nerve pain. In our last video here, I taught you about a 1-minute soft tissue mobilization technique that will improve blood circulation in the foot, because nerve pain or neuropathy commonly affects parts of the body which are distal to the heart, and we need proper blood circulation for nerve healing to take place. In this video, I will teach you what we do in the clinic, but I will modify it in a way so that you can do it at home on your own. This is a home desensitization method that will specifically target your sensation. Hi, this is again Doc Cherry, Doctor of Physical Therapy. Welcome to my channel. In this method, we need to constantly introduce stimulus in short periods of time in your foot. This way, it will provide sensory input to the brain. And if you do this consistently, your body is able to adapt to the stimulus, thereby reducing your body's pain response. To do this, we need to progress gradually from a stimuli that causes less painful response to you and then work our way up. We need 5 stimulus when we do this method. You would need a cotton ball, a toothbrush, sponge, ice cube, or you can use cold compress, and then lastly, you need your hot compress. We need to start with your least affected foot at first. Using a cotton ball, provide light stroking in the plantar aspect of your foot. After providing light stroking using a cotton ball in the plantar surface of your foot as well as your toes, this time go for deep stroking. Try to feel the sensation. Usually, this will not cause any pain, but for some patients who have hypersensitivity, this may be painful for them. And then circular motion using a cotton ball. Do this for 1 minute. We need to introduce our second stimulus, which is the toothbrush. Using a toothbrush, provide light stroking in the toes and in the whole plantar surface of your foot. Observe how you feel. What is the sensation, and try to concentrate on it. After providing light stroking, this time you will do deep stroking in the plantar surface of your foot. Followed by circular motion, and you need to do this again for 1 minute. For your third stimuli, you would want to use the rough portion of a sponge. These may be painful for some patients who present with hypersensitivity to the foot, so adjust it according to your tolerance. Same as we did with our cotton ball and with your toothbrush. First, provide light stroking in your toes and in your foot. After doing light stroking using the rough portion of a sponge, this time you go deeper and provide deep stroking in your foot. And then followed by circular motion in your foot for a total of 1 minute. Adjust these again according to your tolerance. For your fourth stimuli, you need to incorporate ice cube or cold compress. Do with whatever that you already have at home. With the ice cube or cold compress, I want you to put it directly in the skin of the plantar surface of your foot. You can pat it and you can provide light stroking or deep stroking as well as circular motion on your foot. Observe and concentrate on how you feel. Do this for 1 minute. Last, you would need a hot compress or a warmer. So what I want you to do this time is to put it directly on the plantar surface of your foot. You can pat it, you can provide light or deep stroking and circular motion. After doing this in your least affected foot, do it this time with your other foot. Some patients who present with foot nerve pain would even find it hard to walk, and they are unable to determine correctly different sensation. This technique, when consistently done, it will definitely help you. You need a total of 10 minutes when doing this home desensitization method in your home for both of your feet. You need to do this 3 times a day. And you can start feeling the result within days or weeks, depending on the severity of your foot nerve pain. This medical advice is for free. We use this technique in the clinic and I modified it in a way so that you can do it at home on your own. If you find health videos like this helpful, I would really appreciate it if you can click the subscribe and the bell button below so you won't be missing out in our future videos. Also, do me a favor. It would only take 1 second of your time to please click the like button below so that this video would be able to reach out to more people. In one of our future videos, I will be discussing specific foot exercises for foot nerve pain that will target the muscle and improve your balance. I will also recommend the right footwear for you, so do watch out for that. Please share this video to your friends and family members so that we are able to help them as well. If you have reached the end of this video, please comment sensation in the comments section below. I would really be glad to hear from you. Thank you very much for watching. This is again Doc Cherry. Stay safe, stay happy and healthy. God bless you.
Place the heel of one foot on the floor with your toes pointing towards the ceiling. The other foot should be firmly planted on the floor. Slowly begin to point the toes forwards. Hold for a few seconds and then return to the starting position. Place the heel of one foot on the floor with your toes pointing towards the ceiling. The other foot should be firmly planted on the floor. Tilt your ankles so that your toes point towards the left. Hold for a few seconds and then tilt your ankle to the right.
Start off with your toes with a certain amount of distance from the wall and see if you can have your knee touching the wall without lifting up your heel. And then what you want to do is start to slide further back until you get to a point just before your heel starts lifting off the floor. Good, so for me that's about there. What you want to do from there is mark it off with a piece of tape, and you would repeat on the other side or the leg to see if you can get the same distance. So for me, my left side is a little bit tighter, and you can see there right side's going back a lot further.